So welcome. This afternoon's session is part of a series of engagement events that we are doing, that DHCNI are doing, on the new digital health and care strategy. And what I want to do in this session is really outline for you the process that we have been through to date in developing the strategy. I propose to do about 15 or 20 minutes with slides. For those of you who have been at NICON all day, I'm sure it has been a long and exciting day. So we'll not murder everybody with lots of slides. So 15 or 20 minutes of slides, and then some time for some questions and discussion afterwards. So you know, it's quite a crucial time for a new strategy. If anything good has come out of the pandemic, perhaps the best thing that has happened is that we have thought about new ways of doing things out of necessity. So we have people using remote telemonitoring, we have people doing virtual consultations, we have patients booking appointments online, we have patients and clients searching for information and using patient portals, all things that you know, have come to fruition and have been used a lot more during the pandemic. So it's very, very timely that it was the time to refresh the digital health and care strategy. You will know that we had an e-health and care strategy which covered us up until last year, and this strategy that we're developing at the minute is a strategy for the next 5 to 10 years. It's been written in partnership with colleagues from Deloitte who have come in to support the DHCNI team in the process of developing the strategy. And really the key principles of what we want this strategy to be is we want it to be clear, we want it to be actionable. So making sure that everybody knows what their responsibility is and what their actions should be in order to make this come off the page and be something alive and something that everybody can own. Very importantly, it has to be affordable, and perhaps that will be something that we will discuss when we've gone through the slides. It needs to be responsive to the needs of HSC and to the people that we serve. And finally, it has to be measurable. So we need to have outcomes in this strategy that we can measure against to ensure that implementation is going well. Over the next couple of slides, what I want to do is outline the vision, the mission, the principles, the strategic outcomes, and really then demonstrate to you how we have come about those, discuss the underlying digital capabilities and the enablers that we see are important in order to implement and enact and implement the strategy. And then we'll do some slides on the programme sort of overview and describe how we've gone through the engagement process. Next slide, please, Nick. Okay, so this slide shows you what we've been doing to date, and that was really the whole purpose of this session this afternoon, was to keep the audience at NICON up to date about how we are actually going about developing this strategy. So you will see on this slide where we have 4 phases, and the one with the turquoise box around it is where we are now. So we did some scoping and some discovery work. We obviously then did some development of coming out of that literature review, and then we embarked on quite a long engagement phase. And now we've moved into the sort of consultation or conversation phase. And what we have done in that, so I will go into more detail about the engagement phase, but this consultation phase really is to ensure that what we heard, so you told us, we heard, this is what we've done in the engagement. So really this consultation or conversation phase is getting feedback from key stakeholders that what we heard in the engagement phase is what should be in the strategy, and really pinpointing us to the important parts that need to be included, and then we'll move on to our refinement stage. Next phase, Nick. Next slide, Nick. Okay, so this is how the engagement phase has gone. So some of the audience may have participated with us in the workshop, the engagement workshops that we completed over the last couple of months. They were very, very well attended. You can see at the bottom. Given the climate that we're in and how busy everybody is, we were really, really pleased with the amount of engagement that we got from across not only health and social care, but the independent sector, universities, innovation partners, suppliers, etc. So we started off and we had three workshops. The first workshop was on ambition. So that was where we got everybody's juices flowing about what should our ambition be, what should we be striving for in this new strategy. Then we moved on and said, well, okay, if that's our vision and these are the principles that we want to stick to, what are the capabilities? What do we actually need to put into the system in order for us to realize that? And then the third workshop was on enablers and how as does exactly what it says in the tin. What are the enablers that need to be put in place in order for us to implement and achieve the vision that we have set out? And we ran 2 workshops on every topic, and then we had two mock-up sessions which covered all 3 topics for those people that couldn't attend the other workshops. Next slide, Nick. Okay, so this slide shows you really the findings, and these slides will be available to everybody after this afternoon so that people can have a little bit more insight. Not one for reading off the slides when you can all see them in front of you. So the ambition, so you can see there that the ambition is the important words there. It's about, people wanted to see change. We've had a flavour of what that change could be during the pandemic. People wanted the systems and the way that we work and the digital processes that we put in place to be unified and to be intuitive for users, both the public users and HSC staff users. People came out as a very, very strong ambition. This is not about IT. This is not about digital. This is about the people. So when we say people, we mean people in the largest sense, people like citizens, patients, clients, their family carers, and all staff across HSC and beyond HSC. And you'll see the last bullet point there in the ambition was about careers, being serious in this strategy about so careers right across, people working in informatics, in data and data standards, right up to making sure that we have a digitally enabled workforce, health and social care workforce, and that people are thinking digital as they go about delivering the health and social care that they go about delivering every day. Then the second boxes underneath the jigsaw piece there are the 6 capabilities that were identified through the engagement process. And I am squinting very, very, very hard at my mobile phone, which is very, very far away from me, to what the capabilities are. So I'll not be able to read those out because I can't, to be perfectly honest, can't see them. Nick, can you at all magnify the screen, or will I bring my phone a little bit closer to me? Maybe I should just bring my phone a bit closer to me, and then I can see them and explain them a wee bit more. The wonders of modern technology. So the capabilities, patient engagement goes without say. So building services, oh brilliant, building services with for people, with people, making sure that we have future digital delivery through new technologies. So looking and allowing people to be creative in how they use technology, innovation and digital agility, increasing use across and getting our innovation landscape. And if Sue's on the in the audience, so you can perhaps in our discussion talk a wee bit more about how the innovation strategy will dovetail with this digital strategy. Yet again, another capability about the digitally skilled workforce. So providing our staff with the right digital skills, including digital delivery. And there's a large piece of work going on regionally with health and social care professional staff across nursing, midwifery, AHPs, social work, social care, medicine, pharmacy, and everybody in between, looking at a digital capability framework for HSE staff. And alongside of that, we are going to be doing a digital IT and data workforce review, and looking at things like career structure, career pathways, job descriptions, and how we ensure that digital is embedded in right from foundation right through to specialist careers. System integration and cybersecurity, while it is mentioned here, you will all be aware, and forgive me, I don't know when the cybersecurity session was at NICON, whether it was earlier today. And we have a cybersecurity strategy also, which will dovetail into this. And then, very importantly, data-driven care and insights. So making sure that the care that we are delivering is based on evidence and the data. So if COVID has taught us anything, it is about the importance of data, and making sure that we use that data to drive our service delivery and our service development. And then the foundations are our foundations will be, or the enablers came out of the third. So there was 4 main enablers identified from the workshops that we delivered, and they were leadership and culture, digital talent. So how do we recruit, retain, and develop our digital talent, management and governance, and infrastructure and programs. Thanks, Nick. Next slide. So this is a typical, I suppose, strategic framework, and it really just describes everything that has gone in the previous slide in one diagram. So at the top bar is the vision, and then underneath that we have a mission statement. So classic strategic framework. Then we have our strategic outcomes underneath that, and you will note that the strategic outcomes are aligned to the HSE quadruple aim. Then we have our digital capabilities, and then the foundations of the enablers. So the strategy itself will be written to ensure that each of those different areas of the framework are linking back to the mission and the vision. Thanks, Nick. Okay, so when you produce a strategy, you need to obviously give some thought about what's going to be the roadmap. So when we produce this, how are we going to start to implement this strategy? And what we have put out here for discussion is that we would have three phases: implementing, optimizing, and then innovating. Now, this is not to say that, and the next slide will show this, this is not to say that these are mutually exclusive and you have to do all your implementing before you do your optimizing, and you have to do all your optimizing before you do your innovating. What we're saying here is that we have these phases, but we will not, it wouldn't be right to say, given that we implement different programs and different pieces of technologies at different times, that these won't be interlinked, because at times we will have implemented and be optimizing something, we will have optimized something and we'll be innovating. So we're not saying that you have to do this one and move on and move on. These are the three main phases, and we propose that what we have to be very, very mindful of is that while we're implementing and optimizing and innovating, that we do, and here comes the classic line, we have to be very mindful of capital funding, and we have to be very mindful of the programs and projects that we already have in our digital portfolio, some of which have kicked off and are huge big pieces of work, and that obviously will have a knock-on effect of how much innovation and how much optimizing we can do if we're implementing big programs like that. So we need to be mindful of that, and we are mindful of that in writing this strategy. So while we're proposing the sort of the 3-stage, we're not saying that these are linear. These phases will be mixed. Next slide, Nick. And this graph shows that in a different way. So what this slide is trying to show is our thinking behind the years of the strategy and where we think. So at the left-hand side there, you will see that the large amount of effort will be obviously on the implementing, and then we will move in, and then coming over to the right, the larger piece of the work will be on innovating. Thanks, Nick. And this slide is not exclusive. This slide just shows really some of the major programs that a lot of you in the audience will be familiar with, the major programs and pieces of and projects and digital technologies that we already have in the portfolio, and showing how that potentially will look across the 3 phases that we're putting into the strategy. So as you can see, some will continue to be developed, some will be implemented, some will continue to be developed and optimized, and then others will move into the innovation. Thanks, Nick. So this is what we are proposing, the overall structure, or will look for the strategy. So there'll be various sections, and I mean, I don't think there's any of those that really need an awful lot of explanation. And as I say, it's really, it will be the capabilities. While we have strategic outcomes in the strategy, the capabilities and the enablers really are about, are not about the technologies as such. They're about the people and the processes and the culture, and the change management, which are probably the most important things in order to meet the strategic objectives. And we need to be very, very mindful of the effort. And we've all seen the iceberg diagram, where we have, the technology is above the water, but actually all of the other requirements that need to be put in place in order to implement a strategy are all the stuff that is, are all the part of the iceberg that is under the water. So the people stuff, the culture, the change management. So we're not shying away from that, and we are proposing that as part of the capabilities and the enablers, that perhaps we will follow the strategy up with a charter that various organizations within HSE would sign up to. So, when we say digital, careers, or making sure that we create digital talent, well, what would that look like? What would that look like for implementing organizations in the digital? So would that mean that, every trust will have a CCIO, every trust will have a chief nursing information officer, every trust will ensure that digital capability framework is completed by all members of staff? What are those? So what are the actual pieces of the jigsaw that the contributing organizations need to put in place in order to own this strategy and make this strategy come alive? Which, while I was involved in the previous e-health and care strategy, was probably something that was missing, and maybe we can have a few words about that afterwards. It didn't come along with an implementation plan. It didn't feel as if it was owned by the services. It didn't dovetail in with the normal business of trusts and other organisations delivering care. Hence why we wanted to align this digital health and care strategy very much to the quadruple aim, as that's what all health and social care organisations are working towards. And the next slide then, Nick. should be next steps. Yes, next steps. So as we said at the beginning, we will review what we hear from our discussion and our conversation with our key stakeholders, and those key stakeholders also include the public. And I have just signed off this afternoon on a public survey, which will go live probably on Monday and run for a few weeks, asking the public to give us their thoughts on services that they would like to see digitally enabled and what they potentially will use in the future with regards to health and social care and digital technologies and use of data. We will also follow that up with face-to-face meetings with groups of service users and staff as well, because we're mindful that when you do a digital survey, you're getting the digitally enabled and not those that perhaps don't have don't have access to digital technologies. So then we will consolidate that feedback and refine the content of the strategy, and we would hope that we would be publishing before or just before or at the end of the calendar year. So that has been a very whistle-stop tour of what we have done to date in engaging on the digital strategy and how we plan to move that forward. I'm going to put my phone back up here because I don't need to read anything anymore, and just maybe open up to the audience for some questions. Perhaps people have been at the workshops and want to say what they got out of the workshops, or whether they felt that the workshops covered everything, or if there's something glaringly obvious that you think that I haven't said that you think we should be including in the strategy. More than happy to have a bit of a discussion about that and open the floor up to other members. Hopefully there's some fellow DHCNI members in the audience. I can't see who's on because my phone's so tiny. So hopefully there'll be, and also there's colleagues from Deloitte in the audience. So if there's anything with regards to the structure or the strategic roadmap, we're more than happy to answer your questions. So can we open it up and let people ask questions, Nick, or do they have to put them into the box? Can we hear humans?
Absolutely. Anyone is welcome to come on screen and ask Claire a question.
Hello, Claire. Hello, can you hear me okay?
Yes, I can indeed.
Hi, it's Kate Lessler here. I'm working with the Royal College of Occupational Therapists, and you'd mentioned that AHPs were involved in all, but I know Pippa has been very involved as well. But I just wanted to check that you've ensured that there was a good cross-representation of all the AHPs and all of the groups. And also another question is does this link in with the GPs, or how is it working across other areas? And when we're talking about integration, such as across community and voluntary, are there aspects of it that will join up some of the bits that we were all talking about over the conference? Thank you very much.
Yeah, okay. So yes, the invitations to the workshops that we have had as part of the engagement process went out to a huge audience, and we had great representation. And as you rightly point out, Pippa, my right-hand woman, her digital network folk joined us for some of the workshops. And then after the workshops, we have also identified other key stakeholders. So we have also done separate presentations to them and got their feedback on the strategy. And just yesterday, I was with the senior social care network leaders, the social work leaders forum, and presented to them. And obviously on that, given that a lot of social care is delivered outside of HSC by the independent sector, there was representatives on that from the independent sector. And a big part of the strategy, and I perhaps didn't pull that out enough in the slides, is about partnership and about partnership working, and the independent and community and voluntary sector are very, very open to us looking at how we engage and getting there, because lots of very innovative things happening in the independent and the community voluntary sector that aren't happening in HSC. So I think we've got plenty of lessons to learn from them. And they are very, very open to us coming back to them when we get to the implementation plan phase about how we can do partnership working better across and outside of HSC. GPs have been engaged. We've done presentations to the GP unions and to their leadership groups. Does that answer your question?
Yes, it does. Is there still opportunity for, say, certain professional groups to have, engagement with yourselves if they so want it? And also sure. the other one was as well, where we were talking about community voluntary, but I'm also thinking about housing and places where occupational therapists would maybe do some cross-sectoral working and things like that as well.
Yeah, we've done some work. So we've done some work with I can't remember his name now, but a new person who is in post cross-working with housing and the department. And we're
on the line, Claire.
He's here.
There you go. Okay, so so Pippa and I have had some.
Just watch what you say, Claire.
I know. I was going to say, he has this funny accent, So we've had the early conversations, and he's aware of the strategy, and we're trying to look. I mean, it's been an area, you're quite right, it has been an area that, where digital could really help for keeping people independent and living longer and more safely at home. It's an area that has never really been a strong point in strategies before, but yes, we've started those conversations for sure.
Okay, that's great, thank you.
Claire, this is Damien. I have a quick question just about involvement with carers. Have you linked in with the carer groups and the carer community?
No, not yet. No, that'll be part of my public conversation. So linking out to, I've tried to link out to trusts and to Carers NI about it's been difficult, Damien, because a lot of these things aren't happening face to face now.
Yeah.
And then you're very reliant on only getting the digitally enabled folk joining you for a Zoom. So PCC are to get back to me when I get back from a leave, because they were hoping that they would be able to start some face-to-face groups again, so we can plug in them.
Okay, thanks, Claire.
Nobody else? Nothing in the box, Nick?
It doesn't look like it at the moment, but people are obviously still welcome to put their questions there. Looks like we've got a very shy audience.
Yeah, everybody's tired. It's that time of the day. But I think the point there about is there's still opportunity to contribute. Yes, of course, there's still opportunity to contribute, and probably the best way is that we share these slides. Obviously, will be available, and then on a contact. If I send Nick a contact, I'll put a contact on the slides, and then the people, if people want to contribute further to the discussion, they can contact us through that email address. I saw something popping up.
Indeed, Shane's asked, how will this link with the rollout of Encompass?
Okay, so this is higher than Encompass, Shane. So this is sort of the overall strategic direction of digital health and care across HSC, and Encompass is, and in that third or fourth slide there where it showed you all the major programs. So of course Encompass is one of the major, if not the biggest program that we have within the portfolio at the minute. So yes, of course, and there's linkages across when we talk about digital capabilities and a digitally enabled workforce. There's obviously linkages there, and through those big programs, some of those capabilities and some of those strategic objectives will be met through those big programs. But this sort of sits above the program level, of which Encompass is one. So this is more the direction we're traveling in. So that's, the stuff like integration, intuitive, making sure that we, that the systems are linked up and there's data across the systems and data collected once and used many times. Those are all sort of the philosophies or the principles of the strategy. And then the likes of Encompass and the other big programs will bring those to fruition. Does that make sense? Does that answer that, Shane? He's typing yes into the box instead of saying yes or no.
I tell you, he's a slow typer unless he's typing more. Oh, there we go. Oh no, that wasn't even Shane.
No, I think Shane's dropped off. It must have been such a good answer.
You asked the question and then disappeared for the answer. Okay. Anybody else got anything to contribute from the DHCNI team? Is Sue on? No?
No.
No. Okay.
Sue isn't here, Claire, but I am.
Oh, you are. Ah, there you go.
So you mentioned, Sue, in context there of some work going on in the digital innovation space.
Yeah.
And I think you probably covered it as well, but just to re-emphasize it, that we've been working on a digital strategy, we've been working on a digital innovation strategy, and our colleague Austin Tanney has been working on a data strategy as well. And I think it's our intention very much is to bring those three bits of work together, and that will set, I think, a clear direction of travel for all of this here. So I think that does come through in your presentation, and I think it's a great strategy. And I have to say, from having participated in much of the sessions in this conference, Heather, I think the strategy is actually, reflected a lot of what we've been hearing through the NICON conference over the last couple of days. So I think it's good. And as Claire's indicated, we've already had quite a high level of engagement, and the small C consultation process going forward, Claire, the door is still open for people to participate, and we would continue to encourage that.
Exactly.
So, Claire, just from my perspective, I was really pleased just to have digital just so strongly running through conference, because it's such a massive enabler. For me, there was such a sense of we're not building back or finding even language for what new thing we're creating. And I suppose for me, that's why I kind of love the art gallery. It's something else. We're building on what we've got, but it will be something different, and just that system way of working, pushing for the inequalities and a lot of things. With my engagement with the IT companies coming into conference, they were saying that a lot of that sharing of the data allowed them to completely transform their services because they could see where they're being more effective, gives us more evidence. So you can see that's why I love conference, to be honest, because the machine of health and social care is so big. People get so focused on I'm nursing, I'm a clinician, I'm the community sector, I'm the digital health people. The digital health will have to be part of everybody's job. And we have to do a lot of work, I think, to imagine the future. I always use the wee maxim, if you can't imagine it, you can't build it. And I think the danger is that we've all grown up in this system that your automatic instinct is to redesign the thing that you know. And actually, you could tell from Rob's presentation at the end, that's not what they're about. And you could see that when they've collaborated and used the resources better, they've actually got better outcomes with less. So, it's the put it for me, and that again, that's why I love conference. It's the putting of all of those things together. And you can do that when you're at conference. It's very hard to do that when you're in your, let's face it, people have so little time. They're so busy with their own job, but actually just getting your head up is so massively important. So I'm very grateful to you guys for, being so present in conference, and I hope it's been helpful in shaping, or aligning and confirming to you you're going the right direction.
Oh, definitely confirming that, and that whole reimagining thing and everybody being so busy. And that's why we have been so pleased that we have had such great engagement A, during a pandemic, B, during the summer months, you know, because people actually use the 60 minutes, the 90 minutes that we had on ambition, capabilities and enablers to get their heads up and to be able to be in that reimagined space. And, you know, we have learned to do and have chosen to do, and have maybe a little bit been forced to do things differently during the pandemic. So we definitely don't want to go rolling back. We should be building. We should really be building on the really good things and reimagining how we can make things better for the public. And as a side to that, then how we ultimately then make things better for people working in health and social care. So yeah, it definitely brings it all together. It's the direction of travel. But I think the important thing is it has to be owned. It has to be owned by the system, by the HSC machinery. It has to be owned by everybody. It can't be seen as something that has been done onto, and that's why this engagement process that we've gone through has been so important, so that people can see the part that they have to play to make the vision become a reality. That sounded very profound, the vision becoming the reality. But yeah, it needs to be owned by the system for sure, and everybody in it. So thank you, Heather, for those kind words about digital.